2 minutes past 9 o'clock here on East FM. This is the Late Breakfast. I'm your host, Phil, and I'm joined in the studio by Yvonne and also Joanne. Now, as I mentioned before the news, we've had Yvonne in here before. She talked to us just a week or two ago all about skin and how we can protect our skin. And it's all to do with the Crawford Medical Wellness Centre, which I saw on the social media is up and going now. Gee, it's obviously brand new, but it looks so wonderful.
Yeah, so like I mentioned before, Crawford is actually expanding. We're getting into more division, and the Wellness Centre, the Specialist Centre, it's part of the Specialist Centre have been there for a very long time, but now with the the opening of the Wellness Centre, so Crawford's definitely expanding. Yes.
And that's a good thing. It's good, certainly, for the community. And as I said, we've got another special guest with us, and that's Joanne, and she's going to talk to us today about audiology and ears and how we can look after our ears, especially when summer is just around the corner. Although if you look out your window now, you'd think it's here already. But we've had a beautiful weekend, and I guess people, as we talked about off air, Joanne, they don't know too much about ears and audiology until they've been to an audiologist.
Yeah, it is. That's true. That's something that we can just keep an eye on that when we go to swimming or anything.
Yeah, because I'm sure, I know from when I'm not here, I work on TV and I do a lot of motor racing stuff, and I'm sure that my ears probably aren't as good as they once were, just from the fact that you've had that noise, or if you're an engineer or a builder or something like that, all that sort of noise, it makes an effect, doesn't it?
Yes, it is a permanent kind of issue when it comes up. But of course, age is another common issue for people who come to me.
And people, I guess, because it doesn't, I'm guessing once again, I'm thinking that it doesn't hit suddenly. It's just that it creeps up on you a wee bit. And then one day you think, what did he say? I couldn't hear that last word.
It really depends on where you go to usually.
Yes.
Yeah, it's a subtle one that you're right. You don't know much really until you notice, you have to turn things up on TV, on radio when you're driving, or when you go to cafes around. There's a lot of cafes everywhere here, and you might have to ask for repeats.
Yeah, and a lot of people struggle in the conversation setting, don't they? They can hear one voice but maybe not the other two, or it sort of varies.
Yeah, it is.
And is that a sign that you should be doing something about it when it gets to that stage?
Yeah, when you get to that stage, you should do hearing tests, at least to see your baseline of your hearing. That's the first step.
People are often put off, though, aren't they, by the cost? Because, hearing aids and things like that, they're expensive.
Yeah, they're not expensive. It depends.
Sure, yeah.
It depends. Some pretty expensive because of technology is keep improving. Some it's cheaper. If we see somebody coming and say, they need a bit of help, we need to see what they need. I always said that because it's a medical device somehow. It's not something that you buy in the shop.
Yeah, you can't
just
go and get it at farmers. Yeah.
No, you can't do that.
It always amazes me now that Specsavers are into audio now.
Yeah. The market is expanding.
Yes.
The need is keep increasing, I would say that way. So there's a lot of people that keep joining to the market and see how's the competition around.
Is there a simple way that you can protect your hearing or even your ears? I know when even we were talking about skincare, a lot of people forget their ears, and it's a really susceptible spot to skin damage. Is there something you can do as a basis to protect not only your hearing but your ears themselves?
For stay to our topic for summer today, there's a lot of things that we can do.
Yes.
So hedge, or we do lawn mowing quite a lot.
Yes.
So when we use tools, machines that's quite noisy, we always recommend to have ear protectors.
Yes.
All the time. Okay. So if we go to swimming, some people might need swimming plugs to protect ears and so.
This is going to sound stupid. Can the water get in? You know how people say, you swim for a while and you think, one ear's blocked and it's filled with water. But it's not really filled with water, is it? Or is it?
Well, water will go in.
Yes.
But then if
it should come out.
It should, if our eardrums are perfectly fine.
Yes.
It's kind of protection. as well. So at times, if you feel blocked or anything, well, just come to look for Yvonne. That's the first step.
And is it? I know back in the old days they used to do a thing called syringing, and that was basically just putting water in your ear and letting. That was probably to get rid of wax more than anything else, or. Ah, Yvonne's got a hand up.
Well, this is my specialty, really.
Well, there you go.
So, yes, in the I will say the olden days, or in the
yeah, but I'm old. I mean,
well, let's just say there has been a different evolutions and things keep on changing with new technologies and everything. So, in the past, it was thought that washing the ears is the best thing that you can do for the ears. And then you put water, you syringe the ears, and what you're trying to do is soften the wax inside. It's basically just irrigating it and trying to hopefully get the wax, the melted wax or the yucky water to actually get out of the ears. Most of the time, it works. But what people didn't realize back then is that the ears actually do not like having water in there. So imagine yourself being soaked in the water for a very long time, say in the pool, in the spa. When you get out of the water, what happens to your skin? It becomes a little bit wrinkly, it becomes really dried out. It is exactly the same thing in the ears. And if you have wax in your ears, having the water in there, it kind of traps it. It's not everyone's ear canal is the same shape. Some can be a bit curvy, some can be really narrow. And imagine those water that got mixed with wax and everything and got stuck right in there. It's really, really hard for it to come out. So it has been proven, and it's been shown that there's new technologies that can be used out there instead of using water. What we do is called microsuction. So using, I call it a mini vacuum cleaner.
I was going to say, so you suck it out.
Yes, we suck it out as a mini vacuum cleaner. So unfortunately, it's not a Dyson, okay? So it doesn't make a really quiet noise. The machine does make a loud noise, but hey, it's a really safe procedure. And with the right technique, we don't even touch the inside of the ear canal, because what we aim for is we use what we do at Crawford Specialists, we use a microscope. So this is what ENT specialists do. So a very high definition camera, microscope, will look inside the ears, and when we put in the microsuction inside, we hardly ever need to touch the ear canal, because we go on directly on the wax and we suck it out. And there are times that there are wax that's on the eardrum, which is a very, very delicate and sensitive area. And yes, we can also suck it out as well. And I would say it's a very, very delicate procedure. And all of our nurses in Crawford Specialists have more than 10 years of ENT experience. So I guess that's kind of what makes us a bit special, is that we can be a bit precious with our procedure, just because we know how uncomfortable, we know how delicate, and we know how important the ears are for us. So that's kind of, if anything, one piece of advice, anyone that's listening, please do not wash your ears. The ears do not like water. And if anything, the water can also make the ears more prone to infections. Because your body is nice and warm. It's like an incubator, okay? So if you've got water that's trapped in there, and look, you don't wash yourself in sterile water.
No, true.
Yeah, there's always things that's in the water. And basically you're like a petri dish trying to grow stuff inside the ears, and that's how you get the ear infection. Yes.
And the other thing I remember, and I think I remember this from Crawford, from when I had my ear syringe all those years and years ago now, you shouldn't put cotton buds in your ears either.
Oh, yes. That's the number one thing that we always say. A lot of people think that, oh, my ears are itchy, and I'm just going to use a cotton bud to give it a stretch. And what people don't realize is the more you scratch, the more damage you're causing to the skin. And the more, it's a vicious cycle. You gotta have to stop somewhere. And also having moisture in the ears, that's coming back to having moisture in the ears, it irritates the skin. That makes it itchy. When it's itchy, what do you want to do? You'll be scratching. And you could be scratching subconsciously, even in your sleep. That can happen too. So, so that's why keeping the ears is the number one thing and the best thing that you can do to protect your ears and look after your ears.
Yeah, because I think one of the nurses up there said you shouldn't put anything sharper than your elbow in your ear.
Oh, yes. So nothing smaller than your elbow. I say that all the time. Yes.
And people heed that advice? Obviously they do. I mean...
Yes. Well, like I say, it's an advice that I give to anyone that comes into our clinic. And we definitely have seen lots and lots of improvement, because the thing is, people are not doing it on purpose. They don't know, right?
Sure, yeah.
And having that education, knowing the right thing to do, actually, it's the number one step. And we see huge improvement with patient that comes through, listened, and actually do like the advice that we given. There is a huge improvement, and it's life changing. We've been so many patients that walk through the door and say, "Hey, it's a game change. It's a change." And look, you don't even need to buy cotton buds anymore. Saving money, right? Yeah.
Yeah, because I'm pretty sure that's $1 billion industry worldwide. The other thing I want to talk about, and that's dirt,
Yes.
dirt and dust.
Yes.
Is that an issue?
Look. Yes. So
If you're a farmer or something like that.
yes, definitely. So most people don't realize is that ear, nose, and throat,
Yes.
they're all connected. It's the same pipe. So imagine yourself being in a really dusty environment. You end up having a bit more boogie in the nose. You probably feel like your nose is a bit blocked. It is exactly the same thing in the ears, because you're more exposed to pollen, dust, or anything. So the ear, it's exactly the same structure, almost like the nose, is that there are hairs in the ears, and it is there to protect the ear. And most people don't realize that the wax is actually there to protect the ears. So the reason why we produce wax is protect the ears. And what I mean by protecting is that those wax is going to be in the ear canal.
Yes.
So when you have the dust, the pollens, or whatsoever that flies in, and sometimes, yes, insect can fly into the ears, and they get stuck in the wax. So when they get stuck in the wax, that means they can't go any further. They're not going to go deeper inside the ear canal. They're not going to touch the eardrum. And that's what we mean by it is stopping the dirt, the yucky stuff, from going deeper into the ears. And also what happens in the ears, the skin grows from the eardrum out, so it pushes and pushes and pushes the wax out. So the ears, believe it or not, does clean itself. The skin keep on growing, and that's how it pushes the wax out. So not everyone needs to have ear suction. There are people who wear hearing aids, or who a lot of Joanne's clients does. So that's where they might need an extra bit of help from us, trying to get the suction, help suction and get the wax out, because everything got pushed in. There are people who say need to wear earplugs at work, so that would end up pushing the wax in, and that's when you need an extra piece of an extra hand from us to get them out. And a big part of it is actually genetics. Yes, some people do produce a lot more wax than they can get rid of. They have narrow ear canal, they have curvier ear canals. That all have impact in terms of how blocked your ears can be. And yes, and unfortunately maturity does play a little part of it as well, because our skin cycle becomes a lot slower. So that means the amount of time for the skin to grow and to push the wax out can be delayed. Change in hormones can be one of the things as well. So like puberty.
So menopausal women and things like that.
Yes, definitely.
Yes.
That actually has a huge impact.
Oh, wow.
Yeah, and stress. I believe Joanne would have a lot of impact. I mean, a lot of insight when it comes to stress and how people perceive tinnitus as well. So Joanne see a lot of those. So, yeah.
So in the chain of command, for example, it's probably the wrong word, but you have a problem with your ear.
Yep.
You go and see you.
Yep.
And then you refer to Joanne?
Yes.
Or an audiologist?
Yes. It can be the other way around, because there.
Oh yes, because they pick it up first.
Yes. It can be. It can be other way, or it could be as simple as you going to the GP. GP do a general check, have a look inside, and say, "Oh, your ears are blocked," or "Oh, I have an ear. My ears are sore." When I have a look, I say, "Oh, your ears are blocked." So that's kind of. There's no step 1, 2, 3. It's more of a whoever sees it, what's happening. We're all a multidiscipline, a collaborating team. That's the other way of putting it. So yes.
So that leads me to another question. This one for Joanne. Explain to me the steps you'd go through if, say, for example, I made an appointment to come and see you. How would it go from me coming to see you? What would you do? What would be the first step?
Usually what happens is I will ask, have you ever done any hearing tests
Yes,
before?
yes.
That's the thing. So I'll ask a lot of questions about it. So what sort of difficulties that you come across? What sort of ear conditions in the past? May have ear infection in the past also. When I ask everything, including family history somehow,
Yes.
then I'll have a look of the ears.
Yes.
So like what Yvonne is saying.
So that's like a detective's work, isn't it? That gives you a bit of a baseline thinking, okay, well, this is the symptoms. I think I know how I can fix this.
When I get the answers,
Yes.
I'll somehow get some idea of it.
Yes.
But then when I have a look of the ears, that's wax. Okay, hold on. We just stop from there. We can't do any hearing test from there. It's not accurate somehow.
Oh, yes, because you're not going to get full benefit.
Exactly.
Yes.
When there's something blocked in the middle, it has to be way louder for you to hear things. It's going to be very muffled. So I will just pass to Yvonne. So that's how we refer people just all along.
And you get out the Dyson, and away we go.
Oh, yes. Oh, yes.
One more question, because I don't know much about ears. I don't know much about anything, but that's another story. Earbuds. Are they a necessary evil or an unwanted distraction? Because forever people say, oh, don't put earbuds in your ears. And yet you can't. That's all you buy now. Your phone, your audio systems, it's all earbuds.
That's a very good question, though. There's a bit of studies going on in the UK. It's not there yet. They're saying that they're a bit concerned. You know, when you go to buy earbuds, there's something like noise cancelling.
Yes.
It's been very quiet. But they're thinking about whether that will actually affect your brain to process if you're in a noisy place. Brain is very clever. We need our ears and brain to hear things. What happens is our brain can able to separate in between noise that you don't want to hear
Yes.
and the conversations that you want to focus on. But then if you have earbuds in all the time, so everything's been very quiet, your brain, to be able to separate these things, is going to drop.
It sort of needs a contrast, doesn't it? If you're just blasting music in your ears all the time, that's all you're ever going to hear.
Exactly. Let's say if you're on the street, things been very quiet.
Yes.
You're not aware of what's happening. So that's a safety issue as well.
And we talked about running the last time Yvonne was here, and there's no way you should run with earphones on.
Yeah, exactly.
Not a chance. Unless it's on a track or in a park or something like that. I mean, you can't hear cars. I know I was guilty of it when I was cycling. I thought I'll just pop my buds and go for a ride, and you think, gee, I didn't feel that car behind me before.
Yes, and I
you
guess
learn by your mistakes.
yes. I guess I'll jump in here as well, because
sure.
we see that a lot of people wearing noise cancelling earbuds. That's the number one thing that we notice, is that they tend to push in really, really deeply, because to try to get the full seal. And also that sometimes it becomes to the point that, oh, my ears, it doesn't feel like it's loud enough, and what they don't realize is actually wax. And because there's been continuous being pushed in deep inside,
so that's pushing the wax in as well.
Yeah, and towards the eardrum. And obviously, because it's so deep, you may not be able to see from the outside of the ears, right? So they don't realize it was so blocked, and they just keep on pushing and pushing.
So
and
that makes it worse.
Yes, and they keep on turning the music louder and louder, thinking that it is something to do with the earbuds, and not realizing it's actually wax. And what happened from there is that, obviously, that what Joanne mentioned before, it's because of the high noise, and it can actually affect the brain, affect the hearing, and cause trauma to the hearing at some point. But also from a physical point of view, if you keep on pushing the wax, you can end up pushing onto the eardrum. You can cause damage on the eardrum. We've seen bruising on the eardrum, and people have temporary hearing loss because from that trauma. We call it a trauma because that's what it is. People then uses people can be really creative. We have seen blue ink in the ears before.
Really?
Yes, because they've been using a pen to try to clean the ears, to scratch, and all sorts of things. I've seen matches.
Oh, wow.
That does happen as well.
Wow.
And
that's not good.
Bursting the eardrum. Yeah, and that can happen. And bursting the eardrum, yes, the eardrum can actually heal to a certain point. Some may not ever heal, and you have a perforated eardrum, and not to mention the impact that you have on the hearing. So
explain to me perforated eardrum? Because I think my mum had a perforated eardrum. One of her eardrums was perforated.
Oh, that will be Joanne's specialty. She can explain everything about perforated eardrum because you see that's quite a bit.
Oh, that's quite a lot.
Yes.
Yeah. So it really depends what's the cause behind and how long has it been. So I've seen some people, let's say they just got informed, oh, your eardrum's perforated.
Yes.
And they was like, oh,
It's
really?
been like that forever. Yeah.
Like, oh, really? Okay. We did hearing test and this kind of matching. That's what I do, being a detective somehow. And I'll just get them to like, look, I'll get you to come back for a certain time
Yes.
to see if that's going to heal. Let's do the test again. If there's improvement, if I can see the eardrum is healed, that's fine. But that if that's not, I'll see what's happening. So is there any infection also? That's the thing. Or if somebody got that years ago and they look for the doctor's advice and they say, look, it's not able to repair anything.
I think that's what, well, my mum's passed away now, but I think that's what they said with her. There's nothing we can do.
Oh, if that's the case.
It was a long time ago.
Oh, okay. If that's the case, water precaution is one thing. So
Yes.
if there's a hole, we don't want to have any water goes in further. So that's number one thing. So for people who got that might need hearing aids at some stage, if they notice a bit of difficulties somehow, because that's part of the pathway that's going to help us to hear things.
You know how you said that the shape of your ears and everything is hereditary? Is hearing loss hereditary, or is that just a ipso facto of the shape of the eardrum and thing like that? So, see, for example, my dad was pretty deaf. Does that mean I'll be deaf?
It's a yes or no.
Okay.
It's a yes or no. I must say, for everybody, even for myself,
It's different, yeah.
it's different.
Yeah.
So in terms of shape and sizes, let's answer that first. That won't affect hearing,
Okay.
that's for sure. Even if we have big ears or small ears, that's fine. As long as there's no damage somehow, okay? But then some people unfortunately got that at earlier stage. Might have the shape is different, got some parts missing in the ear, then they have hearing issue since born, or it might just comes from genes. So it's something progressive.
Yeah.
When they get older, they'll just knew it.
Yeah.
But that's what they usually being screened when they were born and being monitored if they have certain family history somehow.
As a rule of thumb, how often should you get your ears checked?
On an annual basis,
Oh, yeah, once a year. Yeah.
yeah. I mean, for people, especially,
Unless you've got
Yeah.
symptoms and having trouble.
yeah. I mean, for people who go to have ear suction, so when the point that somebody's saying they got some noise in ears with wax, probably, something blocked, wax, possibly. After they do these things with Yvonne's team, ear suction, they got that done, but that didn't help. Then that's the time for the person to come and have hearing tests.
And the other thing, and people, when you talk ears, people all know this, tinnitus.
That's a big one.
It affects lots and lots of people, but it affects them pretty silently, doesn't it? Unless it's really, really bad. They just live with it.
I know. I mean, there are certain stages, I would say. So it usually is something created by your brain.
Okay.
Okay. For most people, I would say it's been very quiet over the years' time until you can hear something from your ears, which you've never heard that before. So for people that's got hearing issue, as they get older,
Yes.
so brain will try to compensate. So that's the point that the brain is, oh, let me just create
Something's a
something.
bit different here. Yeah, I need to adjust this.
Just to create something to fill in the gap. Oh, you missed something in your hearing. Let me just add something to you. So that's the point that they start noticing something. It's not something we call disease. It's just something that's a sign for you to, okay, let me just get my ears checked.
I worked with a guy a few years ago now, and strangely enough, he was an audio engineer at a radio station. But he said his tinnitus was so bad, like it was just screaming in his ear the whole time.
Ooh.
I mean, surely he should have done something about that years and years ago. It's obviously got worse.
Should have gone to Joanne.
Yeah, exactly. One last question from me. I learned such a lot from these interviews. One last question from me. Why the relationship between ears and balance?
Because the ears is a balancing organ. Basically, that's what it is.
Okay.
And Joanne, have looked like you something that you want to put in?
I mean, for us to let's think about the reason why we have two ears. We want to detect what's happening, the direction. For balance, for sure, we have ears. Balance is something really complicated. It's not just about ears, but also eyes and
Yes.
things like that. But for ears in particular, when thing is not quite balanced, then we have a balanced organ inside, semicircular canals, something like that. Try to detect which side is it. Or for hearing in particular, might be, usually for us, we have really similar hearing on both sides. But what about some people with very different hearing? So that's causing balance
Like
issues.
different left-right balance.
Yeah.
Yeah.
And
Oh,
it's
okay.
Causing.
And I remember we had this conversation before that we were actually joking, saying that inside the ears, it's like a gyroscope inside.
I was
So-
going to say
so,
a spirit
yeah.
level, but yeah.
Yeah. So it's in the ear, there's a gyroscope. Basically, we have a gyroscope inside.
Yeah.
Yeah.
So that's kind of the easiest way to say in terms of the relationship with balance and the ears.
But if you have an inner ear infection, that can certainly affect your balance,
yes.
can't it?
Oh, that's for sure.
Big times. Big times. Yes.
Oh, that's awesome. Okay, anything else you want to add?
No, I guess this is also my opportunity to say, come to us at Crawford
Oh,
Specialists.
obviously.
We're
yes.
at number 12 Picton Street. You don't need a referral. And hey, if you're ever unsure, feel free to come and book in. We can have a look. And if there is, if you're not sure the next step, and obviously coming to us, we can have a look inside and give you a bit of diagnosis of what's going on. And there's sometimes from there, it could be going back to your GP to get some eardrops for infections, or going to Joanne and her team on audiology for hearing tests on the next thing. Look, the ears is a really, really complex, and we don't have, unfortunately, I would love to have like the whole day to talk about ears, but look, we have limited time, so if you have any questions, you know where to find us.
Awesome. Thank you. Well, thank you, Yvonne and Joanne, coming up and having a chat to us this morning. It's been enlightening. It really has. I mean, like I say, every interview we've done with the Wellness Centre involved, I've learned such a heck of a lot. I should probably adhere to some of the rules that I've learnt, but we'll get to that. All these good things take time. Thanks very much for coming in, ladies. Really, really appreciate it. All the best with your success with the Wellness Centre and with audiology. It's something that probably people dismiss, but we probably shouldn't, because obviously if it's an eye problem, it's you know straight away, oh geez, I can't see anymore.
Yes.
But when you're going a little bit harder hearing, you think, oh, it must be a loud room or something like that, and you sort of dismiss it, which you obviously shouldn't.
Yeah.
So it's a misconception that I can't hear. It's because I'm getting older.
Yes.
It's actually not true. A lot of the times, people actually come and say that I've been told that this ear is no good. But in fact, it was just blocked ears, and we clear it, and hey, haven't got the hearing back for many years, and now they can hear. So that happens too.
And the other thing, and just before I let you go, like I said, my dad was deaf, and I always thought that deafness was just the sound turned down, but it's not, is it? It's
No.
like
No.
subjective deafness. You can hear some words, but you can't hear others. So it's
And
a conversation like that.
And it also has a really big impact on mental health.
Yes,
Dementia.
because you draw into yourself, don't you?
Yes, and dementia being a really big part as well. So yeah, so look after your ears.
You only get two, so make the most of them.
Yes.
All right, thanks again.
so thank you.
Really appreciate you coming in, taking your time out from your busy day to do so. That's Yvonne and Joanne. We've been talking about ears, folks, and if you haven't heard, you need to book an appointment.